All right, hi, I'm Yanila. I'm in my last semester as an undergrad as an exercise science major, and I'm starting PA school next month here at IUPUI. I'm helping out in Dr. Hubel's lab, specifically with a study on muscle fatigue differences between high intensity interval training and moderate intensity continuous training. So why am I interested in research as an exercise science major? There we go. So as an exercise science major, as a pre-PA student, you always get asked why exercise science as a major, and I definitely think that kinesiology research directly impacts the medical and treatment side of healthcare, specifically with chronic diseases such as obesity, diabetes, and cardiovascular health. One of the biggest trends right now in training is high intensity interval training, or HIIT training, and this is because it's very time effective, especially in today's society where a lot of people say they have issues being able to implement exercise into their daily routine. HIIT can be an awesome form of exercise for exercise adherence. So some of the improvements that HIIT has as compared to moderate intensity continuous training is an increase in anaerobic capacity, markers of cardiovascular fitness, VO2 max, insulin sensitivity, and endothelial function in the heart and blood vessels. But there's not a lot of research done yet on how HIIT affects fatigue. And this is a problem because fatigue can negatively affect exercise adherence, injury risk, and chronic diseases. So the study that I'm working with, we are trying to see how HIIT affects fatigue as compared to moderate intensity continuous training using a rower. So typically when we have subjects come in, they come in for 3 sessions. In their first session, they just sign their consent form, do their PAR-Q, and we get them acclimated to what they'll be doing in the second and third sessions. And then when they come to the second and third sessions, we set them up on pre-testing on the Biodex for knee extension strength and the hand grip dynamometer for hand grip strength. And then we get them on the rower. They will complete in the second and third sessions 2 rowing conditions. One is the high intensity interval condition and one is a moderate intensity continuous condition. So they'll be on the rower for about 50 calories burned. And then during that time on the rower, we measure heart rate with a chest heart monitor strap and RP every minute on the minute. We get them off the rower when they hit 50 calories and we do post-strength tests again on the Biodex and the hand grip dynamometer. So then we use the data that we find, and I used one of our subjects' data examples. For the HIIT protocol, hand grip strength from pre to post testing decreased slightly, and then the Biodex strength actually increased from pre to post testing. And then as compared to the moderate intensity continuous training, hand grip decreased a little bit more as compared to the HIIT training, and then the Biodex strength actually decreased pretty significantly as compared to HIIT training. So this could potentially be really good results for what we're trying to find through the study. And then again, my personal attraction to this study is that I believe exercise prescription can be a type of medicine, especially for chronic diseases. With my experience in my major and my experience with research the past few semesters, I definitely want to be able to implement what I've learned as a practitioner when I finish PA school in a couple of years, and I definitely believe that kinesiology research works hand in hand with medical treatment.